Hi, everybody. Welcome to the Benzo Warrior Community Roundtable Zoom meeting. Tonight, we welcome Dr. Christy Huff. Dr. Christy Huff is the director of Benzo Information Coalition. She will speak with us here on our BWC Zoom. Christy Huff is a cardiologist and director of the Benzodiazepine Information Coalition, a nonprofit that educates about the adverse effects of prescribed benzodiazepines. Dr. Huff attended medical school at the University of Texas Southwestern. She is a fellow of the American College of Cardiology and was a private practice cardiologist in Fort Worth, Texas, until 2011, when she became a stay-at-home mom after the birth of her daughter. Dr. Huff experienced benzodiazepine adverse effects and injury firsthand after 3 weeks of prescribed Xanax use for insomnia in 2015. Over a 3-year period, she slowly tapered off benzodiazepines, utilizing Valium, and suffered a protracted and disabling withdrawal. Her personal experience led her to realize the serious risks of these medications and the severity of the benzodiazepine withdrawal symptoms, neither of which were emphasized during her medical training. Dr. Huff specifically advocates for better education for physicians regarding the adverse effects of benzodiazepines and how to safely taper patients off of these medications. In addition to her work at BIC, she is a member of the Colorado Consortium's Benzodiazepine Action Work Group. Please help me welcome Dr. Christy Huff. And Christy, feel free to share your, to do a share screen for your
Yes.
program.
Thank you. So thank you so much for that lovely introduction. And it's so great to be here. Give me just a minute while always takes just a minute to get this going here. All right, I think we are up and running. So tonight, the topic of my talk is benzodiazepine-induced neurological dysfunction, which I'm going to refer to as BIND for short, because the other is kind of a mouthful, and we'll be talking a little bit later exactly what that is. And we're doing this from the perspective of the caregiver. I'm going to assume if you're here tonight, you're either got a loved one that's experiencing issues with benzodiazepines, or maybe you've been affected yourself. So this is the bird's eye view of my talk. First, I'm going to be sharing my benzodiazepine story because I've personally been affected, and I just want to share it from the standpoint of letting you know how bad this can be for your loved one, and also to hopefully give you some hope that that things do get better. We do heal over time. Next, we'll be covering the benzodiazepine experience survey, which I was involved in, and looked at, some of the things that were going on in the online support communities. We'll cover the FDA box warning that was updated in 2020. We'll learn all about BIND and exactly what that entails. And lastly, I'll share some practical tips for the caregiver. So we'll start off with my story, and this is just pictures of my family. This was before I was affected by benzodiazepines. These pictures were taken like in late 2014 and early 2015. And I'm married to a radiologist. My daughter's 4 years old at this point, and we just had a normal, happy family. I had actually been out of cardiology practice for a few years at this point. I had a big surgery on my leg, and after my recovery, I just never really made it back into practice. I was going to plan on going back after my daughter had entered elementary school. Well, that never happened because I was prescribed benzodiazepines, and my life was never the same after that. So this is just the overview of my benzodiazepine story. I was prescribed Xanax during a health crisis to take for sleep and also to deal with the anxiety of the situation. I was prescribed 0.5 milligrams up to 3 times daily as needed. And at first I just took half a tablet at night just to sleep because I was, trying to be careful with it. Well, I had some strange symptoms that developed, and within a few weeks, I had developed, in hindsight, physical dependence and tolerance on the medication. I was needing more medication to get the same effect. And I was having severe withdrawal symptoms in between doses. This is also called interdose withdrawal because the half-life of Xanax in particular is so short. And now I never took more than prescribed. So this wasn't an addiction problem. I wasn't abusing the medication. These were just the normal effects of taking this medication for some of us. After I figured out what was going on, I switched over to the Ashton method to taper. For those of you that aren't familiar with Professor Ashton, she was a British psychopharmacologist in the United Kingdom that had a clinic supporting benzodiazepine patients coming off their medications in the 80s and 90s. And I've got her manual pictured here. And the manual basically is a culmination of her work with benzodiazepines, and it has protocols for coming off of benzodiazepines. So I switched over to diazepam to taper, or also the trade name is Valium, because the longer half-life helped me cover that interdose withdrawal. But even I tried to follow her protocol at first, but it was too fast for me. And I ended up having to slow it down, but I still kind of use what we call the cut and hold method in the groups, where you cut the dose and then hold it for a few weeks until symptoms sort of stabilize, and then you cut again. Well, later on, I transitioned to a technique called micro taper, which is sort of a catch-all term for making little tiny reductions in your dose. And I used a scale to do this. Some people use liquid formulations, and it took me a long time. You know, I thought at first, you know, I'd be just off this medication in a few months. And it took several years, even with me trying to push myself with the taper. Today, I'm over 3.5 years benzodiazepine free. And while I'm doing a lot better, I still have some protracted symptoms that I deal with on a daily basis. So I just want to highlight a few things that happened during my experience. First of all, even though I'm a physician, finding help was really, really hard for me. Once I actually figured out what was going on with me on the internet, I stumbled across the website Benzo Buddies. And before that, my doctors had been putting me all through these medical tests, you know, trying to figure out all these strange symptoms that I was having. Well, when I finally knew what was going on, I went back to the doctor who'd prescribed the medication. And she said, there's no way you could be dependent after a few weeks. You can just, you know, stop it abruptly. Of course, that wasn't an option. I was just having, you know, severe withdrawal symptoms, even trying to reduce the dose even on my own. I went to see a psychiatrist, and she didn't think much of my benzodiazepine dependence. She said, you just have anxiety and depression. Here, take these 3 new medications, which I didn't do because I knew that wasn't what was going on. But she treated me like I had an addiction problem. Her solution to coming off the medication was just to give the pill bottle to my husband as if I couldn't, you know, control my use. And that really wasn't the case. I called an inpatient mental health facility, and they said, you're only on 1 milligram of Xanax. This is too low. We can't really, why are you having such problems? We can't really help you. Fortunately, I did find a doctor that was able to help me. I brought a copy of the Ashton manual into his office, and he believed me. And he said, you know, we're going to work together to make a taper plan. He had never heard of the Ashton manual, but he said, this looks good. We'll get you switched over to diazepam. So I did that over the course of 6 weeks. And so I tapered over the course of 3+ years. Despite my slow taper, I experienced 80 distinct symptoms during my taper, and I was, you know, extremely ill. And I won't read all of my symptoms here, but I think some of the worst things I dealt with was just a severe crushing fatigue. I had elevated heart rates. Towards the end of the taper, I developed postural orthostatic tachycardia syndrome, and so I was so dizzy that I couldn't even stand for more than a few seconds. I had suicidal ideation, trouble sleeping, problems with my memory and thinking. And, you know, you can see my picture here. This was me towards the end of the taper. And I didn't even recognize myself. I just, you know, I was so sick. And it wasn't just a laundry list of symptoms that I was experiencing. This affected my life in all areas. I gained a lot of weight. I was bedridden during parts of the taper. This obviously contributed to increased healthcare costs. I dealt with, other things come up during a taper. Potentially, I was diagnosed with breast cancer, and I had to deal with that during my taper, and that complicated my cancer treatment plan. And this whole thing was just utterly disabling. I lost my independence. I couldn't do basic things that people take for granted, like walking and cooking and driving a car. So my life was impacted basically in all areas. Now, fortunately, my story has a happy ending. I was able to come off the medication, and the last 3.5 years off benzodiazepines, I've just spent rebuilding my health and my life. And you can see I made a decent amount of recovery. Even that first year off, I went from being bedridden to being able to take my daughter on a trip to Disneyland. So that was great. And, as far as the things that helped me, I would say probably the biggest thing was just time fully free of the benzodiazepine, having that out of my system. And then my nervous system was able to slowly put itself to rights. But it also took some acceptance of my symptoms instead of fighting them, and, general exercise. And I started with very low level physical therapy after my taper was over, and just worked my way gradually up. I've been working with my doctor on my health issues and watching my diet. I lost some weight, and then stress reduction and boundaries are very important for us, even during a taper, because our nervous systems are just so sensitive. So I just want to impress on you how bad this experience can be for some of us coming off of benzodiazepines. I write and talk about this subject frequently, and I really have just difficulty capturing it in words. I mean, there's some words here that I've written that I use to describe my experience, but something about it just eludes me. It's just that bad. And I would say for 4 years during this experience, I really had little quality of life. And my only goal was just to survive and get through the day. Now, that's not the case for me anymore. I'd say about, 4 to 6 months off the medication, I was getting better and life was looking pretty good. And I don't feel that way anymore. But during this time period, hope of returning to my daughter kept me alive. My family and caregiver situation, this is not something that I generally talk about in my talks, but I think it's relevant tonight. And I think one of the reasons I don't talk about it is it's just sort of painful thinking about it, because this process was actually really devastating for my family. I was the wife and the mom, and I was the person that kept their family together. And when I was, taken out of the equation, so to speak, our family just fell apart. I would consider my caregivers to be my husband, and my mom also helped out a little bit, but she was also a caregiver for her husband with Lewy body dementia. So she could only do so much. We ended up having to hire a nanny to just ensure that my little daughter was cared for and help manage the household. And I had, someone helping clean every couple of weeks. But as you can imagine, that's very costly, and not everybody can afford that. My husband finally went part-time at work about halfway through the taper. So we took, a financial cut, and we let the nanny go. And then we just sort of limped along for the next few years until I started to get better. And this was a huge strain on my marriage and relationship with my daughter. My husband will tell you he probably wasn't the best caregiver. I mean, he had to go to work every day and keep the family afloat. And again, I was just making sure the child was cared for, and I just sort of limped along basically. And it was a difficult situation. So beyond my family, most of my support during this taper was actually online or from people that I had met online. Again, I actually made the diagnosis of what was going on with me from reading Benzo Buddies. And I was actually shocked at what I found there, because people were undergoing these long and difficult tapers. They were having severe symptoms, and people were tapering each other, and a lot of them didn't have doctor support just because they couldn't find a doctor knowledgeable about the process. And I realized that I hadn't received very good training on this in my medical training, because I didn't know anything about this situation. But the more I became involved, and it became clear these people knew what they were talking about. I actually wrote an article back in 2018 about my experience in the online support groups, which, kind of interesting. First, I got all my support from Benzo buddies, and later on I got involved in some of the Facebook groups as well. Of course, Benzo Warrior wasn't actually, I don't think it was actually there at the time, but it's a really good group from what I've seen. So I'm glad you're all here and supporting each other. But what I wrote about, just my general support group experience, the good parts of it is that I was able to meet other people that were the similar place in their taper, going through the same thing, and we support each other. And I obtained emotional support and also friendship. But the bad thing is, there are horror stories in some of these groups. There's talk of suicide, and that can be triggering for members. So you really have to protect yourself. I mean, one of the things that I did was I made friends with people online, and then we would take things offline and talk maybe via text or kind of like by Zoom, like we're doing now. That wasn't available to me back then, but that's one strategy that can be used because, like I said, we really have to protect ourselves in this. There's also misinformation that can be shared in these groups. So everyone has to be really discerning about this. And, what I have written down as the ugly aspect of the online support groups is that they have to exist because bind and other adverse effects from benzodiazepines are not currently recognized in the medical community. And so because of that, we don't have a formal support system, and there's nowhere else for patients to turn. And again, I felt I also had nowhere else to turn but to go to these support groups. And I'm glad I did, because I mean, if I had to be honest, I think, it saved my life. So that concludes my portion of the story. So I'm here talking to you tonight, just based on not what just happened to me, but what happened to so many other people as well with these medications during my taper. And then later on, I became involved in advocacy work. I met people from all over the world who've been affected by benzodiazepines. And it got me wanting to, really make a change and educate the medical community about the harms of these medications and what people are actually experiencing. So in 2018, I was approached by a survey maker who was actually affected by benzodiazepines herself. And she designed a survey to assess people's experiences with benzodiazepines. And it was open to people who were currently on a full dose of benzodiazepines, people that were tapering, or even people that had fully come off the medication, whether that was by a cold turkey or whether they had tapered off the medication. It was basically all comers. And we posted online between October 2018 and January 2019. And we posted it in several of the benzo support groups and also some general mental health and wellness support groups as well. And we actually had our first paper published in April of 2022. And this is good news because some of the, our experiences are getting out there into the medical literature. And we have a series of papers that are going to be planned in the future. So I'm just going to give you the highlights of the general results. And again, we're going to delve more into the specifics in further papers, but this is just basically some highlights from the first paper. So we had 1,207 people that responded to the survey about 3/4 were from the United States, about 3/4 were female. And we think this is because females are more likely to be prescribed a benzodiazepine, and also they're probably a little more likely to be using an online support group. And then the age, most people tended to be above 30, which fits with what we see in the people that are taking these medications as prescribed. You can see people who are taking different benzodiazepines. Clonazepam was the most common. And note that some individuals may have taken more than one benzodiazepine. Maybe like me, they had been on one benzodiazepine and they changed to another one to taper. There's just probably all sorts of different situations. And we can see that 91% of respondents took their benzo definitely or mostly as prescribed. And you can see the breakdown as far as who was still taking the medication, who was tapering, and then people that were fully off the medication. So we asked about 23 different symptoms in the survey that can be associated with benzodiazepine withdrawal. And this, again, I experienced up to 80 symptoms. So this 23 is, just some of the symptoms that can be experienced. I would say a lot of these are the most common, or maybe some of the more symptoms that we were interested in investigating. And I think the most important thing to get from this is that a lot of these patients had these symptoms lasting months or years, even after discontinuing the medication. And then we also asked about life effects, which are really important. And because we want to know how, again, it's not just a lot of symptoms, but how are they affecting the patient's life? And you can see in all these general areas that are listed here, between 70 to almost 90% of the respondents were affected in these areas. And we asked about some other specific consequences, and a few of them really stood out, like suicidal thoughts or even attempted suicide. 54% of people experienced this. And, I experienced this during my own taper as well. And we'll talk a little bit more about that in depth later on. As far as, some more results from the study, respondents were asked to fill out some multiple choice questions, and we left a box for write-in comments at the end. And by the number of comments that we received, we really just got the idea that we couldn't really capture everyone's experience just with a series of questions, which I could have told you that just from my own experience. But people wrote some really impactful things about how severe their experience was. And I'll just read two of them to you for the sake of time. But one says, if I could think of the one worst possible thing you could do to a person, it would be benzo withdrawal. Beats cancer and Alzheimer's combined. Benzos have completely destroyed my life. Existence is beyond torture. I do not believe I will survive. And I've got to say that I feel that person. That's the way I felt during this. But just know that things can and do get better. So let's turn to the FDA boxed warning. Again, that survey documented the experience of patients going through this, and obviously some of them were dealing with some quite severe experiences. Well, the FDA finally started to catch up with patient experience as of September of 2020. They updated their boxed warning. Boxed warning is basically the FDA's most serious warning. They used to call it a black box warning, and now it's just boxed warning. And they had put one of those warnings out in 2016 for benzos in combination with opioids, saying that they could cause people to stop breathing and overdose. Now in 2020, they added on the risk of benzodiazepines in their own right. So they noted the serious risk of addiction, abuse, physical dependence, and withdrawal. Now, what I talk about mainly is physical dependence and withdrawal, because that's what our population of patients, for the most part, is experiencing. The FDA did note in the warning that people that are, suffering from addiction and abuse of these medications are more likely to be abusing other substances. So polysubstance abuse. So like maybe they're taking them with opioids, alcohol, and other medications of abuse. And they did note an interesting thing that symptoms of protracted withdrawal can last 12 months or more in some cases. And this is the first time that they have documented that. So what they recommended based on, some of their findings, they recommended standardizing warning labels across the drug class so that basically the same warnings would be on the Ativan label and the Xanax label and the Valium label. They recommended judicious prescribing, and that's just a fancy word for saying really think about whether these medications are needed before prescribing. And, it's also recommended that they're kept in the short term, less than 2 to 4 weeks. And as far as coming off the medication, they recommended a gradual taper to come off the medication. Now, they did a pretty extensive review. Leading up to this warning, they looked at the literature, they looked at their adverse events database. And I want to put in a plug here for the FDA MedWatch program, which is the adverse events database. If you or your loved one have experienced an adverse event, you can report that to the FDA. Just Google FDA MedWatch, or there's actually a link on the BIC website as well, and you can enter that report. It's fairly user-friendly and easy to do, and just something important, because you can see that from time to time the FDA actually goes in and they use that information. So in this case, they reviewed 104 reports, and what they found there was nothing that was really shocking to us that work in advocacy. It's stuff that we already knew, but it was good to have the FDA actually put it in writing. So they were seeing that adverse events or problems can occur with prescribed therapeutic use. So you can have problems just taking the medication as prescribed. The average length of withdrawal symptoms reported was 9.5 months. So withdrawal can be a long process. They said that physical dependence can occur within days to weeks. The average time to onset of that was 14 days. And that abrupt cessation or stopping the medication abruptly or tapering it too quickly were causing adverse events, mainly increased withdrawal symptoms. And they noted some common themes in the reports. They saw that benzodiazepine withdrawal was often being misdiagnosed, and that led to either increased dose of the benzodiazepine or polypharmacy, doctors just adding on medications to treat the new symptoms caused by the benzodiazepine, when really the patient just needed to be tapered off the medication. And patients were told wrong things about tapering. They were told they could stop the drug abruptly just since it was a low dose. Patients were told to taper also too quickly. I wouldn't even consider it that a taper, but just they were told things like, just cut the dose in half and you'll be off in a couple of weeks. And this also resulted in withdrawal symptoms. And I'm going to read this statement because I think it's important. The FDA concluded in their report that there's a lack of awareness or misconceptions among prescribers about appropriate management of patients taking benzodiazepines. And I have to agree with them based on what I know I was taught in medical school, and also what patients are experiencing that write into BIC. We get probably at least 100 emails every month of patients that are looking high and low for a doctor that can help them taper at a gradual pace and help them get off the benzodiazepine safely. And so it's a really significant problem that our patients are facing, and prescriber education is, really an area that we've been targeting in recent years. So let's talk about the protracted symptoms. This is a topic that's near and dear to my heart because I still have some protracted symptoms left over. And I think this syndrome can cause, quite a bit of suffering in our population. It doesn't happen to everyone. Ashton, based on her work, said between 10 to 15% of people coming off long-term benzodiazepines might have protracted syndrome lasting months to years. And things can tend to get better over time. It just can be a very long process. Again, I'm 3.5 years out and I still do have some remaining symptoms, but things just continue. It's not a linear process, but things just continue to get better and better for me over time. Currently in the literature, this is called either protracted withdrawal. That's how Ashton defines it, or maybe the post-acute withdrawal syndrome, also pause. You may have heard that. And we think it might be from the brain adapting to the benzodiazepine's presence in the body, or maybe even neurotoxicity, like the benzodiazepine is toxic to the nervous system. And I've put a nice picture of a GABA receptor over here just to show you that, we're not going to go into the science because I don't think it's clearly defined, but we know that benzodiazepines do bind the GABA receptor, and that's where they exert their effects, and they enhance the effect of GABA, which is the inhibitory neurotransmitter in the body, and they just tend to slow things down for us. And we know that, the nervous system adapts. Those GABA receptors are downregulated. They may even be damaged in the process. Like I said, we need to work out the science more on that, but that just takes time for those receptors to upregulate and then the receptors to heal. So I still struggle with fatigue, although that's a lot better. My heart still pounds occasionally and I'm sensitive to stress. I really still have to protect myself. Occasionally have difficulty finding words. So if I stutter a little bit in this presentation, it just happens sometimes. And then, short-term memory loss, I have to write everything down to keep myself on track. So the benzodiazepine nosology group, which is basically a fancy term for a group that's naming something. This was convened by the Alliance for Benzo Best Practices last year, and they convened 23 experts with both clinical and academic and lived experience. I'm one of them. And we wanted to settle on a name that really described the nature of what was going on in this subset of patients that were really struggling even years out after coming off of benzodiazepine. Because currently these symptoms are disbelieved, they're ignored, they're overlooked by doctors. And because of that, there's no awareness of the problem, there's no research, and patients are lacking support and treatment options. So we came up with the term benzodiazepine-induced neurological dysfunction. And that's fairly self-explanatory. That means the benzodiazepine is inducing functional problems in the nervous system. And again, we'll just call that BIND for short because it really is a mouthful. We came up with a definition of it, basically functionally limiting neurological symptoms, both mental or physical. And it's basically related to exposure to benzodiazepines. And this can happen while you're taking the medication. I know that's the way it happened for me. Things went sideways again within a few weeks of starting to take it, or it can start during the taper and even persist afterwards. But again, after you're off the benzodiazepine, things do tend to improve over time. We need further research to exactly define what the syndrome of BIND really looks like, and also figure out who's at risk and how we can prevent it and how we can treat it in the future. So I'm going to hit just a few, I think, sticking points that come up with benzodiazepines. First is the issue of addiction versus physical dependence. And I just want you to know that FDA actually does make the distinction between these two things. Again, I told you what I was experiencing was just physical dependence. I didn't have the 3 C's that are the hallmark of addiction, which would be like cravings, compulsion to use the drug, or continuing to use the drug despite consequences. And so again, physical dependence and withdrawal are just an expected effect of being on a medication long-term. And the DSM-5, if you heard of that, actually confirms this as well. They have an 11-point scale for diagnosing substance use disorder, which is another term for addiction. And tolerance and withdrawal are on, are 2 of the 11 things listed, but the DSM says it does not count in the setting of, long-term prescribed medication use. And this is just a nice visual showing you that of the big population of people that are prescribed benzodiazepines, it's just a very small proportion that are experiencing addiction or a use disorder. I want to talk a bit about suicidality because that's an important issue that comes up with this process. If your loved one is expressing suicidal ideation, you should definitely take that seriously. Again, we saw that in the survey. It's documented in the medical literature. And, as far as what I've seen, suicidal ideation can be a side effect of the benzo. It can be a withdrawal symptom. I had these random intrusive thoughts, telling me to harm myself, even though I didn't want to die, at that moment. It was just something that was invented by my brain as a result of the drug and the withdrawal. And I haven't had those thoughts after about 2 months free of the drug, then that they've never returned. And then there's another thing that happens with these people that are experiencing protracted states, protracted symptoms. You just get weary because these symptoms just keep going on, and you get despair because you're like, I don't know if things are going to get better. And so it really just becomes a battle of the will. And so just recognize that this can be an issue with your loved one. And I'll point you towards some suicide resources at the end of the talk. Your loved one is going to potentially face stigma on all fronts because these drugs are controlled substances. They're used to treat mental health conditions. And then we also have people with protracted symptoms or they're being disbelieved by their families and medical providers because there's just so much lack of awareness on the issue. So you basically have the stigma of addiction, whether or not the person is actually suffering for addiction or not. That stigma is still there. There's the stigma of dealing with mental health issues. And there's the stigma of, dealing with a chronic invisible illness. And I've put illness or invisible in quotes here just because, if you really, as a caregiver, if you know what to look for, you start to recognize, these things that are happening in your loved one. My mom's gotten, pretty good at it. Word about tapering. It's very important to know a benzodiazepine should never, ever be stopped abruptly. That can be extremely dangerous, can result in seizures and even death. We know that best practice is a flexible, gradual taper plan tailored to the patient's symptoms, especially in that as prescribed patient population. And just know that medical detox is, not the best option. If the patient is not having any issues with addiction or abuse, then they're going to be best served by a gradual taper because that detox, the patient's just taken off the drug so rapidly. And, we've seen anecdotally some adverse effects and even neurological damage from patients being taken too rapidly off the drug. And, a patient-centered taper going at the patient's own pace can take months or years. And this is just a nice picture for you showing the importance of tapering. The first graph up top shows the shaded areas, the magnitude of the risk of the withdrawal symptoms. And you can see it's really high with just stopping it abruptly. And then when you're making the last 2 graphs are a taper, and the one on the bottom is making smaller, more frequent reductions. And you can see that has the lowest risk of withdrawal symptoms. So let's talk again about support because that's something our patients in this population are lacking. Catherine Pittman, she's a psychologist on BIC's advisory board, and she ran a study on benzo buddies back in 2013, and she had 493 participants in the studies. And this lists, where they were getting their support. You can see that over 50% got their support online, but support from a family and friend was 40%. So you guys are extremely important to us. And, less so people are getting support from the medical profession, including psychiatrists, general practitioner, and therapists. So again, caregivers are really important. So we just have a few minutes left here, and I just want to give you some tips specifically geared towards the caregiver. This slide just tells you what we as benzodiazepine affected individuals want you to know. And these are things I would have wanted to know, or what I would have wanted my family to know. First, that what we are experiencing is very real, even if you can't see it. Next, that our brains have been injured by benzodiazepine. So just think of it as a brain injury. So if your loved one is acting strangely, irritable, angry, this is a manifestation of what's going on in their brain. It's, not necessarily a mental illness, or, they're being a terrible person or anything like that. They have an injury, and that it's as serious as a heart attack or cancer, or, it's a serious situation. But, please be forgiving of us if we don't act like ourselves. Just know that the healing process can take a long time, and be patient for us, or patient with us. Know that even if we can't express it because we're just so busy surviving and dealing with our illness, know that we care about you very much. And know that, we're sick. There's some days that we just don't feel up to leaving the house. And that's not because we're just being lazy or malingering, or like we really just don't feel well, and it's going to make us worse to get out. And lastly, for those of us taking the meds prescribed, we don't have a drug abuse or addiction problem. We didn't bring this on ourselves. Nobody would want this for themselves. Most of us were just simply following our doctor's orders, and we had a bad outcome. So this is just a nice list of what not to say. And I took this from Baylissa Frederick's Recovery and Renewal, which I think is a great book to pick up, especially if you're new to the withdrawal experience. Baylissa is a benzodiazepine survivor herself, and she's also a counselor and therapist that works with benzodiazepine harmed patients. And, her book contains tips for surviving withdrawal, and it's written, it's written to the patient, but it's also got a chapter for caregivers and doctors and therapists. So I just think it's a really great help book. But she said not to say things like, snap out of it or pull yourself together. Don't suggest going back to work or volunteering, especially if symptoms are still really bad. This is not something you can really just pull yourself up by the bootstraps and power your way through. Believe me, I tried. Don't tell him or her to stop crying. Just let them feel whatever they're feeling in the moment. Don't say other people are worse off. This is one of my pet peeves, and I think one of my mom's favorites that she would always tell me. And then don't ignore the person's distress or pretend that withdrawal is not happening. My husband was a master of this one. So, and tips for caregivers. Like, these are things that you can do for the individual. This is not a comprehensive list, but just sort of some general ways that you can help. And then you definitely need to tailor what you do to the individual and their needs. So first of all, just start out from a point of belief. Believe what's going on with them. Research the condition. You're here, which I think is a very important step in learning about the condition, learning, how it can be best manage and how you can help support the individual through this process. Provide reassurance. And, you know, you may have to do this very frequently with us because we're just basically in survival mode, living in the moment. And we're going to ask you, am I going to get better? Am I going to be okay? Am I going to be like this forever? And you just got to be like, look, it's going to get better. Just hang in there and get better. And it'll sound like you're on repeat, but we need that in the moment. Create a calm environment, because again, our nervous systems are very sensitive. Sounds, smells, movement, you know, any of that can be triggering for us. Be an advocate for them at doctor's appointments. It is so hard going to your doctor and trying to explain exactly what's going on, you know, with you. And so it's just important to have that family member that can also help explain as well. I know back when I was in clinical practice that a patient encounter just always went better when there was a family member present, because there was always somebody there advocating for that patient and kind of sharing some additional pieces of the story that might be relevant for the physician to help the patient. Also, just ask the individual how you can help them. And maybe they can tell you, maybe they can't. And in that case, I know there was times where I couldn't even express what I needed, but someone might identify a need and, you know, just take care of something practical, like, you know, childcare, or handle the meal situation for that day. Or, you know, there's all sorts of practical ways you can help people. And lastly, encourage the individual to develop a support network. I will tell you that there's no way that you can do this all on your own, because it's just so challenging and so much. And so really the individual is going to need to learn to spread out that support to multiple, you know, multiple people, so that everyone, you know, can get through this process. Which leads me to compassion fatigue. That's something that, you know, we hear commonly in the context of healthcare workers, that working long hours, you get burnout and you lose your ability to empathize or feel compassion anymore. But we're recognizing that this actually occurs in caregivers as well. So you're definitely at risk for that. And there's some things that you can do to combat that. You need to make sure that your needs are taken care of in this process as well. First of all, just know that your safety is priority. That's not negotiable. If your health or safety is threatened, then you don't have to stay in that situation. And then these are just some practical things as far as taking care of you. It's, you know, just basic stuff. And, you know, like care of the individual is also going to be, you know, tailored to your needs as well. But you need to make sure you're getting some movement every day, adequate sleep and nutrition, meditation can be good, just to help calm your nerves. Schedule time to recharge, and that will look like, you know, it may look different just depending on, you know, your needs, but spend time on a hobby. My husband actually took up music and playing the piano and the viola during this time, just to help recharge. Go out and meet up with friends, or just take a walk outside. And just know that it's okay to outsource, recruit help from your family and friends. And if you have the means, definitely consider some paid help as well. I know that's not, you know, something everyone can do. And so that concludes my talk. I just wanted to end with sharing some resources that can be helpful. The first one is BIC's website. We've got a great resources page, and it's got a copy of the Ashton manual there. It's got a list of benzo-wise, or we call them benzo cooperative doctors, who could help with, help your loved one with a taper. And it's actually got a list of some of the common support websites and groups. So definitely check that out. The Alliance for Benzodiazepine Best Practices, I mentioned them earlier in the talk. they've got good information on their website, although it's a little bit more geared for prescribers. Next, we've got Easing Anxiety. This is Dee Foster's website. He does the Benzo Free podcast, and I would suggest checking out his podcast because it's just really informative and supportive. And he's got some really great, he's got a page on his website called For the Caregiver. When I was going through looking for resources for this, there's just not a whole lot out there geared towards the caregiver and benzo-affected individuals. And I would say this is probably the best web page to start because he's got 10 tips for the caregiver. He's got suicide resources listed. He's got some blogs like written by Jennifer Lee and Baylissa, and then also several videos as well. And I think there's some videos from Benzo Warrior that are linked in the resources that I've asked him to add on to that page as well. So it's just a, really comprehensive page there for you. And lastly, we've got the Benzodiazepine Action Work Group that's based in Colorado. And all of these three organizations are working together along with some other medical professionals and other types of healthcare workers. And we're all working on this benzodiazepine problem. And we've got a peer support training program that's starting up in October. The pilot program is starting in October, and hopefully we'll be getting more information out about that. But we're going to start training peer supporters and as another means of support system for benzodiazepine affected individuals. So we're going to go into the Q&A portion.